Well, hello everyone and welcome to our session entitled Patients as Partners in Care. My name is Iona. I'm a Patient Safety Improvement Lead at the Canadian Patient Safety Institute, and together with my colleague Janet Bradshaw, we will be hosting the session today. I'm welcoming you on behalf of Patients for Patient Safety Canada and the Canadian Patient Safety Institute. I see lots of old friends on the line, those of you who know who Patients for Patient Safety Canada and CPSI is, but let me introduce those two groups to you. Patients for Patient Safety Canada is the patient-led program of the Canadian Patient Safety Institute. It is also the Canadian arm of the World Health Organization's Patients for Patient Safety program. For over 12 years, the volunteer members of Patients for Patient Safety Canada, most of whom experienced unsafe care, partner with CPSI and many organizations from Canada and across the world to make care safer. So it is my pleasure to welcome you to a webinar prepared, developed, and delivered by patient partners for you, patient partners as well as providers. In the registration form, you asked us lots of questions about how to partner with patients in your work. We have forwarded those questions to the two speakers today so they can prepare them, but we have lots of Q&A during the session later on that we are going to address some of your questions. Until then, please continue to use the chat and Q&A as you've been doing so far to ask questions, make comments, and connect with the others on the line. As you notice, we have intentionally left the participant list visible to everyone because we want you to make connections with your colleagues working across the country. So why don't you scroll down and send a private chat to your colleagues and make better connections. This session is recorded because we want to make it available to some individuals who could not join us on the line today. So that's the reason, and together with the slides, we will make this available to you as well as publicly on our website. So with this, I would like to now take a moment to introduce you the wonderful Teresa Malloy-Miller. Those of you who attended the webinars know her because she is our moderator for the Canadian as well as the global webinars on patient engagement. Teresa has been a member of Patients for Patient Safety Canada from the very beginning. We've done lots of wonderful work together, and unfortunately, the loss of her son, Daniel, is the reason she joined our community to make care safer. In addition to being a member of Patients for Patient Safety Canada, Teresa is also a member locally in London at the London Health Sciences Centre. So with this, I would like to now hand all of you over to our wonderful moderator today, Teresa Malloy-Miller, who is calling from Delaware, Ontario, Canada.
Thank you, Iona, and I welcome everyone today. We're very excited about this topic. So being today Patients as Partners in Care, this is something we firmly believe that having all of us as we become patients and family members to be more involved in our care, and this is how healthcare is going to move forward. So we're delighted to have, and you can see in our objectives, we hope that everyone today will leave with one idea that they can use right away to gain ideas about what the role of an empowered patient looks like, as well as some practical tools to support engagement with patients and family members, and to identify strategies that would facilitate partnership between patients, families, and providers. So we have two wonderful speakers with us today who I will introduce in just a moment. Crystal Massey is a member of our Patients for Patient Safety Canada group, and she's going to share her family stories. And then Dr. Amy Nakajima is going to respond as the healthcare provider. So we're hoping through this format of story sharing and feedback that you will get some very wonderful strategies about patient empowerment. So now I'm going to tell you more about Dr. Amy Nakajima. She provides obstetrics and gynecology consultation services at the Wabano Center for Aboriginal Health and at the Bruyere Continuing Care Center in Ottawa. She's a recognized expert in patient safety, an active educator at the University of Ottawa, as well as a learner herself. She's completing currently a master's in human factors and systems safety through the Lund University in Sweden. So we're delighted to have Amy with us. Amy has contributed to many patient safety resources, including the Canadian Disclosure Guidelines, the Patient Safety and Incident Management Toolkit, safety competencies, the Canadian Medical Protective Association's online patient safety curriculum, the Royal College of Physicians and Surgeons, Just Culture of Patient Safety, and the Physician Competency Framework. So she's been very busy. And throughout her career, she's advocated for patients to be partners in care. And so we're delighted that Amy was able to join us today. So next, Crystal Massey, as I said, is one of our members from Patients for Patient Safety Canada. And she's taking a risk today. She's telling stories about her family, and this is a difficult thing to do, but she does this from a place of passion. Crystal started on this journey of being an advocate for patient family needs as she became, in the early 90s, when her children were victims of substandard dental care and were greatly harmed by that. So not by choice, but out of necessity, she learned to advocate effectively on behalf of her children. This opened her eyes to realize that getting involved in your own care often leads to better outcomes. She's made this a life and a career path, and this continued and increased when her husband was diagnosed with cancer in 2004. She lost him and 5 other family members within 7 years. So she certainly learned that advocating was important. She's done this professionally on a volunteer basis for family, friends, acquaintances, and other people that are referred to her. She's built her skills through directed research, evidence gathering, and considerable effort with many people. She's made an impact at area hospitals in her area. Crystal does this in honor of those that she's lost, including her husband and her mother. She is very passionate about patient engagement and empowerment and partnerships, and she holds dear the inherent value of patient advocacy. So I'm going to hand this over to Crystal, and as I said at the beginning, Crystal she has 3 stories she's going to share. So she will share her story. Amy's going to provide some feedback from the healthcare provider perspective, and then we're going to open it up to questions. So and through this, Crystal is going to illustrate in detail the patient empowerment strategies that she's found helpful. So in that way, we're going to share them with you. So I'm going to hand this over to Crystal. So welcome, Crystal.
Thank you. Happy to be a part of the process today.
We're delighted you're here.
Thank you. Okay, now I wasn't sure, Teresa, if you wanted me to go directly into the 3 stories of my family, or if you wanted me to explain a little bit about what brought me into this to begin with.
I think you could make a statement about I know I've said a little bit, but I think we could hear that from you and then certainly go into your first story.
Okay. In the early 90s, I worked for a large corporation that offered employees a dental plan that provided 100% coverage if we opted to use their preferred provider. Financially, this benefit appealed to me, and because it was recommended by my employer, I believed that it would be a wise choice and a good selection. My 2 oldest children, ages 8 and 9 at the time, began treatment with this preferred dental practice and were in turn referred to their affiliates called the Orthodontic Group. They determined that braces were required, and my son underwent removal of 6 baby teeth while my daughter had 8 baby teeth extracted, and we were instructed that this would be a 2-year process. Nearing the 3-year mark, we noticed that my daughter's appearance had changed drastically. Her mouth appeared shrunken, and when she smiled, her jaw jutted off to the left. I believed something was terribly wrong, and in fact it was. After speaking to the provider, who reassured us that all was well, we sought second, third, and fourth opinions. And while no dental professional was willing to go on record, they informed us that my daughter had had 2 permanent teeth removed in error and had received substandard orthodontic care. As a result of that, we learned that she'd have to have an expander applied to the roof of her mouth to widen the upper jaw, and she'd have to have, once again, undergo treatment with braces. My son fared slightly better. He'd also have to have his braces removed and begin the process again. Requiring a new dental provider and wanting to understand the previous treatment, I requested my children's dental records and mouth molds. The previous provider released my son's record and mold willingly, but informed me that my daughter's records and mold had been lost. So at the end of the day, it actually took legal action to retrieve my daughter's records and mold, and at that point it was verified that she had in fact had 2 teeth, permanent teeth, extracted in error. To receive coverage for the second application of the braces for both my children, again, legal counsel was necessary, unfortunately. In order to prevent future harm to other children, I contacted the Royal College of Dental Surgeons of Ontario and lodged a letter of complaint. Between this governing body, our solicitor, my own personal investigations, it was determined that the orthodontic group misrepresented themselves and my children were not, in fact, treated by actual orthodontists. One of the main providers, in particular, resigned as a member of the college, and his binding agreement never to apply for reinstatement of his certificate of registration to practice dentistry in the province of Ontario was mandated, and I learned it was not the first time this group had an infraction. So in all, my children spent 8 years in braces, and because of the movement required to realign my daughter's teeth and correct her bite, she has experienced severe root absorption, and now as a young woman, she's facing tooth loss. Because of this experience, I no longer believe that we should leave our health care needs in their entirety to the professionals. This ideology might absolve us of any effort or responsibility, but adherence to such a mindset creates vulnerability. And as you indicated earlier, Teresa, you know, time moved on and we returned to normal life, and the experience was dulled by that. But when I lost 6 family members in the early 2000s, including my husband and mother, I was reminded once again of the need for awareness and advocacy.
Thank you for that.
Yeah, you're welcome.
Yes, so, and this is a major story. So why don't you go on to now that first story you were going to share and start to illustrate the strategies that you have. Okay.
I believe we're beginning with Christy's story.
Yes.
So just for background purposes, it's important to know that at age 16, my youngest daughter, Christy, was diagnosed with fibromyalgia. Now, she's a strong, independent, and very stoic woman. Even with her limitations, she graduated from university with a BA in psychology and a double minor in philosophy and art, and later returned to school, graduating with distinction from the renowned Stratford Chef School. I know she was often in pain and unwell, but you'd never hear a word of complaint from her. And I'm relaying this information so that you understand when I received a phone call late at night and heard my daughter saying, "Mom, I need your help. I'm so sick and I can't make the doctors understand," that she truly was in peril. She explained that she had extreme swelling on the left side of her jaw, intense pain worsened by touch, and the inability to swallow or eat for the last 48 hours. She felt incredibly weak and unsteady and was fearful for her well-being. She had taken herself to the local emergency department where they determined that she had a golf ball-sized submandibular enlarged node or a salivary stone in her salivary gland. The ENT on call was contacted but declined to come in when she learned that Christy had neither a fever nor an elevated white blood cell count. She recommended that Christy follow up with her family doctor early the next week, and that's when I got the phone call from Christy. I took her back to another hospital located across town, hoping for a more favorable outcome. Unfortunately, we were told that Christy had already been seen to and that it would be the same ENT summoned for either hospital. Her condition continued to worsen while we were there, and it was plain to see that hospital personnel were concerned. They contacted the ENT once again, and still she refused to tend to my daughter. At this point, I informed them diplomatically but firmly that the ENT may as well come in now because we would be returning to the hospital repeatedly until Christy was properly assessed and treated by this doctor. So ultimately, the ENT agreed to come in, and when she completed her examination, she determined that Christy needed immediate day surgery to remove the stone. My daughter requested that I stay with her, which was allowed. When the ENT opened the duct, in her words, copious amounts of purulent material expressed. The doctor, somewhat astonished, looked toward me and stated, it's a good thing she's here, and we weren't expecting this. With much effort and great difficulty, the stone was extracted, and again, there were copious amounts of purulence that expelled. The doctor explained that Christy had not exhibited the typical indicators of extreme infection, which confused the situation. But had it been let go, sepsis, a life-threatening condition that arises when the body's response to infection causes injury to its own tissues and organs, could have become a concern. We left the hospital with prescriptions for an antibiotic and pain medication, and Christy recovered well and completely. Upon later research, I learned that the elderly and immune-compromised patients like my daughter, fibromyalgia is an immune system deregulation disease. They can lack the ability to respond normally to infection. What we learned from that experience was that intuition, recruited support, communication, including a diplomatic but firm voicing of concerns, persistence, and partnership were valuable strategies in this healthcare crisis.
Thank you, Crystal, for that very dramatic story of how sticking with it certainly helps out. Amy, I'm going to ask you to comment on Christy's story and the approach that Crystal took. So from a healthcare provider, how would, in terms of Crystal's approach or other ways you've seen to deal with a situation like this, what would you say?
So, Crystal, I really liked your description of being persistent and respectful, firm and yet respectful, because I think that's how you both get providers' attention, but you can get them on board. Right. And I imagine while you're feeling very concerned, you yourself have your emotions in check. I think that is so important, that once the emotions start coming out both in tone and in language, body language also, then providers, being human, will respond to that emotion as opposed to your actual request. Right. So I think that point is really, I hope, a takeaway for people who are listening, because I think that from a patient perspective is one key strategy when you feel that you're not being heard, that you really need the provider to reassess, right, or reconsider, that you make that application in a respectful but firm manner. And I think that's
I agree with that completely.
That's the sweet spot, to try to get to insist on being heard. Mm-hmm. And I think and as you mentioned with your daughter's situation, she had other reasons for not manifesting as a normal patient, in quotation marks. Right. So to bring that to the ENT's awareness, I think, is also helpful to say, well, I understand that you expect fever and an elevated white count. in my daughter's case, she has another medical condition where she may not manifest, you know, these.
We did explain that she had fibromyalgia, and at the time I wasn't aware of the fact that that could compromise things. I didn't really learn that until afterward. But as you say, I was concerned, no question, but, you know, I didn't allow emotion to get in the way. I just worked hard diplomatically at being able to be heard.
Wonderful. Iona, do we have a question from our participants that we would go to at this point? Or shall we
I just looked at the chat box, and there isn't anything there, but looking at the questions submitted by the participants before the session, there is one that I think would work here, and it is about increasing the awareness of what is expected of patients and family caregivers. So the example you just provided is a demonstration that you are a partner in your care, but how to increase that awareness? What can patients do? What can providers do? What can patient groups and organizations do?
To increase that, what's expected if you're going to be an involved patient?
Yes.
Okay. Crystal, do you want to take a stab? I know you're going to address some of this later, but do you want to take a stab at this now?
Well, I guess really what I want to say to this isn't anything entirely different than what Amy has already said, in the sense of you deserve to be seen as a partner. This is impacting either your health and well-being or that of a loved one. And when you intuitively know that, you know, something quite serious is going on and you're feeling concerned, then you need to have the strength to stay in the game and don't become overly emotional about it, but be insistent, because that's how you avoid situations where things can go in the wrong direction. If you're able to be heard, then the situations can be addressed. And I will say, at the end of the day, the doctor was lovely, and she was very appreciative that we, you know, kind of insisted on staying there, and she was happy to have performed the procedure and had it go well. There wasn't any animosity in any way, shape, or form on either side. We were grateful to be heard, and she was grateful to provide the service that she did.
Wonderful. And Amy, do you have a comment at this point in terms of expectations for patients and family in the health system today?
What I was reflecting on is I think the vulnerabilities of the transitions of care, and being seen in a triage situation like Emerge is one of them. And I think that, well, number one, I'm glad, Crystal, that the ENT, that you had a good experience with this particular staff person. I think one of the difficulties is making an assessment over the phone, because you can't actually see the person.
Right.
So, you know, I do think that in specific situations like transitions of care, I think those are wonderful opportunities for patient engagement and advocacy. Understanding that those are particularly vulnerable situations. So I think, as Crystal demonstrated, that you are diplomatic, that you are respectful, but reiterating your concerns.
Mm-hmm.
Great. Teresa, we got a question from Marianne in the chat box for Crystal. What did you learn later about fibromyalgia and how your daughter may respond differently?
I actually did know an awful lot going in. That particular circumstance, I didn't realize that, or I didn't know that. You know, I guess I'm quite educated, and I've helped my daughter to understand, ultimately in the end, what I really know and understand about this situation is that my daughter is an adult, and she she makes her decisions and makes her choices, and I'm available as a mother and an advocate to support her in whatever way she requires. As I said, I know when I've gotten a phone call that she's tried valiantly herself to take care of her situation, and that's when I come in. Fibromyalgia, very complex condition, a lot of controversy where it's concerned, and they're moving forward with that particular medical condition. But yeah, that's a very complex health condition.
Thank you. We got one more question from Esha to Amy. It is in a critical care setting where following systemic patterns, doctors may perceive both persistent and respectful behaviors as the traits of unreasonably demanding patients. What would you suggest patients do?
I think it's a really tricky and difficult situation to find oneself in, and I speak as both a patient myself and as a provider. I do think some really basic strategies that we read about in crucial conversations, for example, using I statements, I feel. I think displaying some tentativeness about, my understanding is, or this is how I view things, or this is how I've understood it, so that you're not making assumptions about how the physician or the other provider is interpreting. Acknowledging frustration, because as a patient, you're probably frustrated. As a provider, you're probably feeling frustrated as well. So being able to connect, I think, on a human level can be very helpful.
Thank you.
Amy, do you mind if I ask you something in regard to what you just said there?
Absolutely.
Go ahead. Thank you. When I hear the term tentative, I can say that I truly have followed that course of action many times throughout the years as a patient advocate. And the thing I find for me is if I'm more resolute in the way I'm approaching something, it seems to garner a little more respect, and therefore I'm listened to more respectfully. The times when I'm a little tentative or I hold back, I don't always necessarily quite get to where it is we need to be.
Thanks for making that point. So when I mean tentative, and I will say this from a provider perspective, because I work particularly with vulnerable patients,
okay.
What I will say is this is what I'm hearing from you. This is how I'm interpreting what you're saying. Do I understand you correctly? So I have to reflect back to them how I've interpreted the story that they've told me or their concerns, but I don't assume that I got it right the first time. So I am checking in. So I guess I should rephrase that and say, try to still maintain that curiosity. Try to understand where that person is or coming from. Try to encourage them to explain it to you so that, now you've got a conversation, like a dialogue, as opposed to combatants. I think that is a more constructive dynamic. So trying to achieve that as opposed to pushing and having pushback.
Right.
We actually sparked the interest of the audience. We got at least 3 more questions in the chat box, but in the interest of time, I would suggest that we move on to the next part of our presentation, and we'll address those questions later. I do want to note that Danielle has made a very constructive suggestion in the chat box, and I want to encourage all of the participants to go to the chat box and read as well as contribute to the discussion that way. So over to you, Teresa.
Okay, great. Crystal, so I think you're going to go on with Pat's story now.
Sure, and I'll try and move through this very quickly.
But this is wonderful. I think we're getting to the ideas you were hoping to get to, so it's all good.
Okay, thank you. So in 2004, when my husband Pat was diagnosed with multiple myeloma, a blood cancer that destroys bones, electronic records had not arrived on the scene yet. Consequently, when we attended Pat's monthly appointments at the cancer clinic, his most recent test results in paper form were rarely available in his file. Therefore, the treatment decisions made by the doctor were being made based on month-old data. So before long, I made it a practice to visit the medical records department well before each appointment to retrieve the latest test results myself so that they could be made available to the oncologist. I also created an Excel spreadsheet that tracked all monthly blood and urine test results. The spreadsheet was updated prior to each appointment, and the oncologist could discern at a glance whether my husband's numbers were on the upswing, holding steady, or spiraling down. The doctor was truly grateful for my efforts and wished this resource was available for all his patients. In time, it was decided that my husband should undergo treatment with a bisphosphonate drug intended for the purpose of bone strengthening. Through research, I learned that infusion of these types of medications can compromise kidney health in patients with pre-existing kidney concerns. Multiple myeloma patients often struggle with kidney dysfunction. I discovered, however, that if the infusion time was extended to an hour rather than the typical 15 minutes, impact to the kidneys was lessened. So I presented this information to the oncologist, and he accommodated our request of a longer infusion time. As a result, my husband's kidneys remained healthy throughout the course of his disease. So as treatment moved along, a real partnership between doctor, patient, and caregiver was established. But unfortunately, this working relationship hit a bit of a bump in the road. My husband was scheduled for a CT scan requiring, as per standard procedure, an injection of contrast dye. And I researched the specific contrast dye that was to be used for this screening. Upon accessing the dye manufacturer's website, I learned that there was a warning against it being given to myelomatous patients as it can progress the disease. They don't know why or how, but they know that it does. So on my husband's behalf, as a protective measure, I refused administration of the dye. The unfortunate part, and again, emotion stayed out of it. I remained diplomatic, but the discussion about this became a little bit heated. During this conversation, I presented the substantiating documentation from the manufacturer's website, and the scan was performed without the dye. Fortunately, the test results were appropriately clear without it, but I had a number of doctors displeased with my unwillingness to follow doctors' orders. However, in time, the hospital added a new question to their patient questionnaire X-ray contrast injection form, asking if patients had been diagnosed with multiple myeloma. If so, they now use a more suitable enhancing agent or exercise appropriate precautionary measures if a CT scan is required. While my husband did not survive his disease, his quality of life was greatly enhanced by awareness and understanding of prescribed tests and treatments and their respective processes. So I learned being prepared to stand firm in your decision-making if you have done exhaustive research that can be scientifically and or professionally supported takes considerable strength and determination. The benefits are their own reward.
Awesome. Thank you for that. And Amy, would you like to comment on this aspect of where Crystal has really dug into the information and then taken that courage to present it?
So I think, Crystal, one of your strengths is that you are very, very health literate. And not all of our patients are that health literate. So I think that when you are able to spend time doing your research, looking and assessing the quality of your resources, I think that is very, very helpful. And
yeah.
Sorry?
It is key. I agree.
It is key, absolutely. So, you know, spending the time and energy to sift through resources, assessing the quality of the information that you've gotten and your sources, and in fact being prepared to make your case is one of those, I think, strategies. And again, I work with particularly vulnerable patients, and they won't be as health literate as you are.
That's correct. And that, I guess, is the reason why in my mind, having another set of ears with you, whether it's family, friends, or a professional advocate, is an important thing. That you're absolutely right. This isn't everyone's forte. It wasn't mine. I was absolutely, you know, your typical unaware, uninformed patient who just trusted that things would always go right and well. Unfortunately, I've had enough circumstances in my life come along that, you know, I became otherwise. I think you're right. There are those that are going to be completely unable to follow particular strategies. It would be wonderful for them if they had support through family, friend, or, you know, a more informed advocate.
And I think especially for those patients, you know, shared decision-making, for instance, would be a great resource. That requires, of course, the organization to have those resources in place. So again, that will go beyond the single provider and patient and possibly family interaction to a more deliberate system-level planning.
I agree.
So I do think that while talking about the point of care interaction is very, very important, and I think, Crystal, your stories speak to that ability to negotiate the point of care. At the same time, especially for those who aren't as well educated and health literate as yourself, it becomes really obvious that you need to have system level resources and processes in place for patients to be advocated for and with.
Yes.
Okay. Iona, I think we had some questions from the chat box. Do they sit at this point?
They don't, but you just addressed one of the questions we received before the session that was on equity issues in relation to patient safety. So this discussion on health literacy and being able to do that is addressing what somebody was wondering right before the session. We had a comment from Nicole earlier. As an educator in nursing, I look at communication strategies that promote patients' rights to ask questions and the importance of patient empowerment. It starts with how care providers open discussion with patients.
Yes, that open discussion, I think that's key. Well, as I look at our time, Crystal, why don't you go on to your last story, and then maybe we can garner all of the remaining questions into that last story, okay?
Okay. My last story involves my son-in-law, Tyler. My son-in-law, Tyler, has been living with and managing Crohn's disease for many years. Together, we have created and maintained a thorough medical history and have consistently accessed, organized, and updated his medical records. These practices have been of great benefit on numerous occasions, but none more so than when a professional misdiagnosis threatened the quality of his life. We credit our continual record keeping with allowing us to recognize when a presumed diagnosis wasn't ringing true. A patient who suffers from chronic disease may find that any symptoms they're experiencing are automatically attributed to the pre-existing disease, and Tyler unfortunately found himself in these shoes. He became severely unwell with symptoms reminiscent of Crohn's disease, but they were not entirely typical of his past experiences. As Tyler's issues became more concerning, we tried to puzzle out what his current health challenge could be, if not Crohn's disease. Eventually, we realized that Tyler, an electrician, had been working in an out-of-town hospital on a regular basis before he became ill, and we discovered that his symptoms were as much in keeping with C. difficile, a hospital-acquired infection, as they were with Crohn's disease. Tyler's illness progressed to the point of a necessary hospitalization. We explained our concern to the doctors about Tyler contracting C. difficile, but because of his chronic disease, they were more inclined to believe that Tyler was experiencing a Crohn's flare. Nevertheless, the doctors quarantined him until they could be sure. Test results were inconclusive. Certain markers ruled out C. diff, but another ruled it in, and so the doctors lifted the quarantine and decided to treat him for Crohn's disease. We felt alarmed by this prospect because intuitively we believed Crohn's was not the issue. We felt more certain when Tyler became progressively worse on the Crohn's disease protocol, but the doctors pushed forward with their treatment plan. Though he wasn't getting better, Tyler was eventually discharged from the hospital. We made an appointment with the family doctor and asked to be referred to an infectious disease specialist. The infectious disease specialist tended to concur with his colleagues, but did admit that there was some discrepancies. Ultimately, we convinced the doctor to allow Tyler to try a course of antibiotics specific to the treatment of C. difficile, and if there was no improvement, Tyler would resume his Crohn's disease protocol. Happily, Tyler improved immediately, and with continued treatment, he became completely well. Knowing that you're the common denominator in every exchange with every member of your healthcare team, it's a judicious practice to gather and maintain all your health records and reports. And as an aside, if you're denied access, know your rights. The Personal Health Information Privacy Act, passed in 2004, opened the door for greater access to personal medical records. According to the Supreme Court, the doctor or healthcare provider is the owner of the actual physical record, but the patient has right of access to the information contained within. Depending on the healthcare facility, you may be charged for copying of your medical records.
Awesome. Amy, do you want to respond to this in terms of patients and families? How do they get access to what's the best way to get access to medical records, and best ways to keep up with their information? In your experience, what would you add here?
So I think it's very location dependent. For instance, is your healthcare provider that you're interacting with have a paper chart, or is there an EMR? If there's an EMR, can you sign up for email notifications? Do you have access to your electronic chart? Because some places do allow you having limited access or certain access to parts of your chart. So I think it depends on what format your health provider utilizes, and that will dictate how you will get access as well. And I think most clerical staff can help you with that. If you wanted access, ask. They may require you to sign a form, and again, as Crystal mentioned, if there is photocopying involved, you may be asked to cover those charges.
They will also email your records to you as well. I've just had experience with that where it's just as easy for them, and they're happy to just email the information along to you in an attachment, a PDF attachment.
Wonderful.
And if you do have an appointment with a physician, I would ask, can I have a copy of my ultrasound report? And I routinely offer my patients if they'd like a copy. Very often, because I'm in a shared care environment, the patient will actually decline. They'll say, no, it's okay, I know it's here.
Okay, yeah, wonderful. I have oh, go ahead.
I just wanted to mention with Crystal, your son-in-law, I was thinking about how you negotiated that course of antibiotics, and I think that's really key to say that negotiation piece, that if he wouldn't get better, yes, we'll go ahead with the Crohn's treatment.
Right.
But we would appreciate trying the antibiotics first before steroids or some other Crohn's medication.
Right.
Right. Yeah. Wonderful. There are a couple of different questions from the list that our participants sent in. One was about residents in nursing homes and strategies that help them to become empowered, or how best to support them. And Crystal or Amy, do you have some ideas about that particular population? Crystal, do you want to go first?
I think Crystal actually, sorry, I just wanted to say that I think Crystal really exemplifies that strategy, which is family involvement.
Okay.
I was going to say that is absolutely the most important factor in those circumstances.
Yeah, they need that team. And you've talked about building your health care team around you.
Right.
Do you want to add anything more about that, just in that nursing home situation?
Yep, sure. Building your healthcare team, obviously you're the most important member of your own healthcare team. You need to be an active participant and seek answers and solutions in collaboration with each of your healthcare providers. Once again, you are the common denominator, and if you're dealing with any healthcare providers, whether they're conventional healthcare providers or alternative or integrative, it is your responsibility to, keep everybody aware of your circumstances, what you're taking alternatively, if you are by way of supplement or your medications. But yes, by all means, build a healthcare team and be a very, very important part of it.
Okay, and Amy, do you have anything else to add there? Is that?
So I also have a clinic that's inpatient in a long-term complex care institution, and I find that for my patients who are not cognitively intact, that having family involvement is so key.
Mm-hmm. So that
and that is welcome, because if I have patients who are unable to provide consent, moving forwards in terms of their gynecologic issue becomes very, very fraught. So having family involvement is really crucial.
Okay, and that's the key piece. Okay. The other question we had from participants that they had sent in was wondering about on discharge, to have that safe discharge from hospital or a service. What are the best skills or the best ways to support families and patients to have that best discharge plan? Amy, do you want to take a crack at that?
So I think having some standard questions around discharge is really important. So if it's discharged from a surgical ward, how do I take care of my wound? How often do I take my pain medications? When should I be seen again in clinic? When do I come back? What sorts of things should I be aware of? For instance, symptoms of a DVT or a PE, which would be very life-threatening. So I think asking about when am I going to be seen next, what things should I be looking for are important, and asking if there are resources for discharge planning. And if my family doctor, when can my family doctor expect to have discharge summary.
Okay.
And what medications do you want me to be on when I leave? So actively asking those questions is a really good practice on behalf of patients and families.
Okay, good. And Crystal, what would you add at this point?
Yes, I absolutely agree with all of that. Been through those circumstances many, many times, and you know, Amy is right on in regard to that, for sure. The only other thing that comes to mind for me there is obviously, for instance, if it's a patient who's had surgery, I think it's a helpful thing to know, you know, a certain amount of detail in regard to what happened during that surgery. And, you know, a quick example is my mother-in-law who has colon cancer. She had surgery. She and we were told that it went very, very well. The cancer was removed. Everything looked great. We didn't really question anything too much further, but when we went back for her follow-up appointment, we learned at that time that she also had 42 lymph nodes removed, and that of the 42 lymph nodes, 4 of them had cancer. We didn't know that she had lymph nodes removed, and I guess we walked away feeling that everything was free and clear because, you know, we basically got the impression, wrong or right, that it went well, she was cancer-free, and it just rocked her when she found out in the end that they removed those lymph nodes and that they had found cancer and she wasn't free and clear. She wasn't expecting it. We weren't expecting it. Certainly nobody's fault in any way, shape, or form, but it's good to say, is there, you know, is there something I need to know other than what we've been told in regard to what I experienced here?
Okay, just that additional question.
Yeah.
So you're just following up and layer by layer to find out that you get the most information that you'll need to look after yourself.
Right.
Wonderful. Iona, do we have any other questions from the chat box?
We have some beautiful comments and feedback and questions in the chat. Let me go through a few of them.
Okay.
First, Claire says she's loving all these insights. Thanks so much for sharing your experiences. As a brain tumor patient myself, I had to learn how to become more empowered in my healthcare. It was key and actually saved my life in the end. I just did a TEDx topic on this, how to be an activated patient and involve your medical team, and she included the link. So
okay, good.
I invite all of you to go there. If not, we're going to keep this link to share with the proceedings from the webinar. Then Mary Laura says, as a healthcare system and as teams develop tools such as discharge tools, health systems absolutely need to involve patient advisors. It is so important to have their perspective and to have their non-clinical perspective. So if I can ask the two presenters today to kind of make a little note to comment on the role of patient advisors. Those are groups of patients like Patients for Patient Safety Canada who participate as partners in designing, developing, delivering tools, resources, policies, strategies, and so on. So I would like to speak to a few more comments, but then if you can address the role of patient advisors, patient partners. Then Esha notes in the chat that following the model of brilliant resource shift to safety from the Canadian Patient Safety Institute and Patients for Patient Safety Canada, it is really important for all stakeholders, patients, providers, and policymakers to be aware of these important points and be on the same page when discussing partnership. Then Anne says, she noted this a little bit earlier. She said, Christy is a lucky gal, but by now we can say Christy, Pat, as well as Tyler are lucky people because Crystal is such a wonderful mom. How to encourage physicians, especially, that something like this could have a tragic outcome, and we need to learn from this. It could happen again if we don't share this information. So she's just, Anne is just highlighting the importance of sharing this information. We're doing it through this webinar, and there's other channels. Judy then notes that if Crystal has a template or a systematic approach to filing and recording health events, might she be willing to share it with us? We are all moving to digitizing records, but I am a believer that you need a manual paper system to work well before digitizing. It sounds like Crystal has an approach to keeping track that many of us might benefit from. And comments coming, Angie says, then there was a lot of good information here, moving stories and great lessons to take home. I really appreciated hearing Crystal's stories and Amy's responses. Thank you. Vincent says, in addition to being partners in the care process, any thoughts on patient involvement in service planning, service design, maybe even hospital design? And this links to the role of patient advisors and patient partners at organizational and system level. And then Tina asks, how should one proceed when there are no doctors taking on new patients, especially getting a second opinion? Oh, that's a hard one, Tina. Okay. So I think there's two questions here, one around patient partners and another one to Crystal if she has a template or an approach for collecting this information about medical records.
You want to do that one first, Crystal?
Okay. I do this very, very frequently, and I do follow a particular procedure or way of doing it. I've never actually written it out or thought about the processes of how I do it, but I'm happy to do that. I can attend to that. I will say,
and hold on, Iona, if Crystal did that, would we then add it to this?
You could add it to the website as a proceeding if you find anything. And Crystal, the question comes from Judy, who's also a member of Patients for Patient Safety Canada, so you can take it offline too.
Oh, okay. Okay. I did want to say we still are in a place where request for your health information isn't always well received, and there are certain steps that you can take that will get you to the place of receiving those records. In listening to Amy, I have to say you sound like an amazing doctor. You're very open, and I think you must obviously interact very open-mindedly with your patients, which is fantastic. I wish all our doctors operated that way, and this is not a criticism at all. I'm just saying I don't always run into such open-mindedness or care for patient contribution, but you obviously are an amazing example of that.
Well, Crystal, I don't normally run into very, very health literate patients, so I was thinking, I would probably feel very intimidated by you if you were my patient.
And you know what? I think it would be nice for participants to know that Crystal and Amy have not met until now. So even though they tend to agree on a lot of points, they have not rehearsed this. This is just their first time having this dialogue.
Wonderful. We're getting close to the end. We had that the additional question that you raised, Iona, about having patient advisors generally contributing to the system of, whether at committee levels or setting policies. I'm thinking
that there's a few resources that we have on the screen, so if I may move through the next few slides.
Yes.
So I think this one is your wrap-up slides, right?
Yes. And this slide that's showing now this is the overview of the strategies that you use, Crystal?
Yes.
So we just categorized them there, and so this will be in the package that will be available. And Iona, can we also see, there are additional resources that will be in the proceedings, great resources. There are the medication 5 questions to ask on the next slide. This patient question checklist is on the Canadian Patient Safety Institute website. Is a great resource about standard questions to help you get ready or before, after, and during contacts with healthcare providers. This is there's a wonderful resource also on the Canadian Patient Safety Institute and it's noted on the bottom there, engaging patients in patient safety. It's a virtual guide that will be edited going forward, has great resources about patient engagement, patient safety, and partnering for safer care. So there's lots of great resources. The CPSI website is a great place to start. These are additional resources from you, Crystal, aren't they?
Yes.
So that will all be in the proceedings. So I want to thank you both. This has been a wonderful discussion, and I think drilling down very effectively to how, as patients and family members, we can step up to take that very important role. And Amy, you've depicted how healthcare providers, I think, are really ready to welcome us in. So partnership is certainly the way forward. Iona, I'm going to hand this over to you.
Well, we are at the end of our time, so I would like to ask all of you, if you don't mind, to answer a very short a poll. We want to see if the learning objective for the session were met. If you did get at least one practical idea that you can implement, and if you don't mind, any feedback you have for this session or ideas for future webinars that we will prepare for you. So we would very much appreciate that. And I also want to send my thanks to Teresa, Crystal, and Amy, as well as Janet, who's working from behind the scenes to make this webinar happen, and to the over 200 people from across Canada and the United States, I believe, who took an hour of their time to be part of our learning experience today. So a big thank you to everyone. And this thank you comes from everybody at the Patients for Patient Safety Canada, as well as the Canadian Patient Safety Institute.
Great. Thank you all.
Thank you.
Thank you very much.
Yes. Take care. Bye-bye.